PCP was a dissociative anesthetic that was established in the 1950s because of its ability to kill pain. It was used in patients who were going under surgical procedures because it gave them the ability to not feel any of the pain or anything they were going through, and it gave them a trance-like, out-of-body and detached from their environment feeling. It was discontinued in 1965 because when recovering from the anesthetic, patients became agitated, delusional, and irrational. And surgically, they felt that if people had to keep going under for procedures and being exposed to this drug, that it could prevent a problem in the long run of addictions and cravings. PCP is a Schedule II drug today that has no medical value, and it is a white crystalline powder that easily dissolves in both water and alcohol. You can tell from the taste that it is PCP because of the bitter chemical taste, and it is available in tablets, capsules, and different colored powders. With these different forms, it can be easily snorted, injected, swallowed, and smoked. And nowadays, it is most commonly sold as a powder or a liquid that is applied to a leafy material. Most of the time, it is applied to marijuana, and the leaf of marijuana is coated with the PCP, so unknowingly, a lot of people ingest PCP, which if over time on enough marijuana they do ingest it, they can become addicted to it without knowing exactly what they're taking into their body. Other leaves that this can be applied to is mint, parsley, and tobacco, which also cause people to get PCP unknowingly. Some short-term side effects on low doses are distinct changes in body awareness, like when you use alcohol, you become more unaware of things that you were saying and doing, and you're more likely to do things that you wouldn't do if you weren't drunk or on PCP. Your breathing becomes shallow, you become flushed, you profusely sweat. It creates a general numbness throughout your whole body, and there's poor muscular coordination. In teens, this interferes with their growth and their learning abilities, and from this we know that 2.3% of high schoolers have stated that they have used PCP, and that's only the ones who are willing to come out and tell us. So unknowingly, more kids are probably using PCP, and this could create more learning and growth problems. In high doses, you can see hallucinations, seizures, vomiting, and paranoia. And long-term effects of this drug PCP are you can become addicted to it, there becomes a psychological dependence and need for it, you will crave it, you will experience memory loss, and it can also lead to other mood disorders. PCP itself inhibits the reuptake of dopamine, norepinephrine, and serotonin, and it blocks the NMDA receptors. PCP abuse results in dangerous hallucinations that is coupled with aggressive behavior, and this is dangerous not only to the person who is taking PCP, but also to everyone around them, such as family, friends, police officers, other law enforcement, medical care, nurses, doctors, because anybody who has to deal with them can be at risk for the side effects that they're feeling, because the person on PCP lacks any rational judgment. They feel no pain. They think of themselves as invulnerable, so they're more likely to put themselves in risky situations where death or serious injury could happen, not thinking of anybody who is with them, and they are willing to harm themselves as well as others. So when withdrawing from PCP, it can occur within the first day of the last use, and it can last up to 3 months. Along with the duration, you will experience depression, anxiety, violent behavior, as well as suicidal thoughts. And one of the critical points when recovering is to remove residual PCP that resides in fatty tissues so that months or years down the road you don't have a lapse because some has been released from inside your fatty tissue.